Let's dive into the case study and lecture on the efficacy of midazolam for facilitated intubation by paramedics. A 45-year-old male patient is involved in a motor vehicle accident and is found to be unresponsive with clenched teeth, making it difficult for paramedics to perform endotracheal intubation, ETI. The paramedics administer intravenous midazolam to facilitate ETI. The purpose of the study was to determine the efficacy of intravenous midazolam as a drug to facilitate ETI in patients resistant to conventional ETI. The study population consisted of patients who required ETI and were resistant to conventional ETI, treated by paramedics in a suburban municipal EMS system. The methodology involved a retrospective review of all cases where midazolam was used during 22 months. Midazolam was used to facilitate 13% of ON54 ETIs performed by paramedics. Successful ETI with midazolam was achieved in 17 of 20, 85% cases, with a single dose being sufficient in 88% of cases. Key takeaways include the efficacy of midazolam, with a mean dose of 36 milligrams, SD 11 milligrams, and indications like clenched teeth and failed intubation attempts. The use of midazolam can improve patient care and outcomes by facilitating successful ETI in resistant patients. These findings can help develop EMS protocols in practice, potentially leading to better patient outcomes. The hypothesis is that intravenous midazolam is effective in facilitating ETI in such patients. The study population included patients who required ETI and were resistant to conventional ETI, treated by paramedics in a suburban EMS system. The sample consisted of 20 patients who received midazolam out of 154 total ETIs during the study period. A random sampling procedure was not used. The study was a retrospective review of all cases where midazolam was administered. This study used a quantitative approach involving numerical data and statistical analysis. The SD of 11 milligrams for the dose indicates the variation or dispersion in the administered doses of midazolam among patients. Weaknesses include the small sample size, retrospective nature, and lack of data on patient outcomes or potential complications. The findings are important to the EMS community because they suggest that intravenous midazolam can effectively facilitate ETI in resistant patients, potentially improving patient outcomes.